Hello and very warm welcome to this video. I'm Dr. Syed Kazmi here, and today I'm going to talk about the cause of heel pain in pediatric practice. Now let's start with a hypothetical example. So here I give you a scenario of a 13 years old girl who presents with a complaint of pain in her heels, both heels, for the last 2 to 3 weeks. Now she says that this pain is intermittent in nature, that it occurs off on and off, and it increases with walking. So walking is an aggravating factor for her. She's otherwise a fit, healthy girl with no history of arthritis. She hasn't got any ongoing issues. She denies any trauma, she denies any fever, and when you examine her heels, you find that both heels are normal shape, they are symmetrical, they haven't got any swelling, and when you do a forceful squeeze, the lateral squeeze test, that elicits some tenderness, some pain in both of the heels. So the question is, what do you think this girl has got? What do you think what this diagnosis here? So we will come back to this example later on. So let's talk about some of the causes of heel pain. Now, heel pain can occur in children as well as adults. It's a bit rare in kids. I mean, the practice has shown that mostly adults they present with heel pain, but nevertheless, once in a while you can come across the scenario in which you have to see a kid who complains of pain in one or both heels. So let's talk about the causes. One of the most common causes of heel pain, especially if it is unilateral, sometimes even can be bilateral, is trauma. So any injury, any form, and most of the injuries which causes pain in the heel is jumping from a height. So let's say in children, especially adolescents who are mucking around and well, sometimes they jump from a fence or from a wall, probably 6-7 feet, and if they are not wearing proper shoes and if they land on their heels, they can get some significant trauma to their heels, to the extent though it is not fracture, but it can lead to a lot of pain in one or both heels. So that is what we call as an acute trauma. But nevertheless, sometimes the trauma can be repetitive as well. So repetitive means that it's not a significant trauma, but people who use their heels a lot, like for example young recruits who go into the forces, so they have to do a lot of marching. So marching in army places a lot of stress on both heels. So that repetitive trauma, though not causing like stress fractures, can sometimes cause like ongoing issues of pain in one or both heels. Other people who use their heels a lot could be athletes, ballet dancers, they could be gymnasts who are doing rigorous exercises, who are doing rigorous training, and with rigorous training, that can have repetitive micro trauma to their heels, which can produce pain in one or most commonly pain in both heels. The other cause is what we call a severe disease. Now, this is by and large one of the most common causes of heel pain in children in pediatric practice. So what is severe disease? The severe disease is basically a sort of an inflammation. I mean, it's not a frank inflammation, but it produces inflammatory like pain, and it is because of the growth in the calcaneal growth plate. So the calcaneus has got a calcaneal growth plate, and an adolescence, this growth plate, when it is growing, it grows more rapidly as compared to the surrounding bone. So what happens is that it produces a bit of pressure on the surrounding nerves, which causes pain. So it is equivalent of growing pain in the heels, and it's well, I won't say it's very common, but I mean it's not unusual. So you would come across a condition. It's usually bilateral, so it's not one heel, it's usually both heels, and it is also present while it can be increased when they're doing some activity, and to some extent it might also be present at rest, especially especially when they wake up after a good night's sleep. So severe disease is basically a growth, what we call as a fast growth of the growth plate of the calcaneus, which causes pressure on the adjacent structures and causes pain in one or both heels of children, especially adolescents. Then the third one is Achilles tendonitis. Achilles tendonitis is basically inflammation of the Achilles tendon. Achilles tendon is the tendon that where your gastrocnemius and soleus muscles, which are known as the calf muscles, they attach to the back of the heel. Usually tennis players, usually those who do a lot of jumping, who do a lot of athletics, they can develop a repetitive, sort of repetitive forces which actually pull this tendon from where it inserts at the back of the heel, producing traction apophysitis. It is just equivalent of Osgood-Schlatter disease in the knee. So what happens is that there is an inflammation where this Achilles tendon attaches to the posterior part of the heel, and it causes inflammation. So these types of children or even adults, they would complain of pain at the back of the heel. So it is not under the heel. This type of pain is mostly at the back of the heel. Then the fourth one is plantar fascia, plantar warts. Plantar warts usually causes unilateral heel pain because it would be rare to have like warts in the same place on both heels. So usually, and plantar warts are usually hidden. So kids who have got a sort of a bad foot hygiene, and obviously they are wearing socks most of the time, their footwear is very ill-fitting, and their personal hygiene is not good, or even their immune system, if it is not good, they might develop warts. And warts on the plantar side are usually very painful because it has to take a lot of pressure, and especially the heels, because it takes almost all of your body weight. So that's why it's very important that if somebody, child or an adult, if they complain of unilateral heel pain, it's very important to have a good look at the heels to see if you find any plantar warts. And plantar warts, if they are there, if you just scrap them, you might find that they've got brown dots at the base, which are just coagulated capillaries. So obviously that has to be either cauterized or has to be excised. Then the other cause is plantar fasciitis. Now, in general, if we take all these causes, irrespective whether they are adults or whether they are children, plantar fasciitis is the most common cause of heel pain. So what is plantar fasciitis? There is the plantar fascia, which attaches to the medial tuberosity of calcaneus and fans out and attaches to the head of the metatarsal bones. And it's quite a thick fascia because it has to support the arches of the foot. Now, sometimes with repetitive strain, there are micro tears in this thickened plantar fascia, which gets inflamed and gives pain. So people or children who are either flat-footed or even children who have got high arches, like those who have got pes cavus, which might be associated with Charcot-Marie tooth disease or some other conditions, these kids are more prone to develop plantar fasciitis because there is a lot of strain on this plantar fascia, and over a period of time it develops micro tears. Even in those who have got normal arches, it can happen, especially in those children or in those adults who have to stand for a prolonged period of time, or those who have to do a lot of walking or running. So those who are like long distance runners, those who have to stand for a prolonged period of time, like salespersons or sometimes women in the kitchen as well, or people in the army, they can develop inflammation in the plantar fascia because of micro tears, and that is what we call as plantar fasciitis. So plantar fasciitis is basically inflammation due to micro tears in the plantar fascia. Then in old people, one of the common causes of plantar or heel pain is heel pad atrophy. So over a period of time, when you're walking and walking, so heel is supported by the fat, so that fat gets atrophied over a period of time. So then the bone is more close to the skin, and obviously that leads to more stresses on the bone, and that can cause bone pain in the calcaneus or in the heel, which we call as heel pad atrophy. So obviously the fat pad has been atrophied. There is less fat giving the cushioning effects to the heel, and that causes heel pain. Then we have got a group which we call as enthesitis related seronegative arthropathies. This is a sort of a subset of juvenile idiopathic arthritis, which are seronegative. So like they do have got joint pains here and there. There is a history of arthritis in other joints as well, especially the back one, the vertebral column. But we call them seronegatives because their ANA might be negative, their RA factor is usually negative. And one of the common ones in seronegative enthesitis related arthropathies is what we call as ankylosing spondylitis. So if it is a male, if it is a boy, adolescent, who complains of heel pain, especially when he wakes up in the morning and there is a lot of heel pain and heel stiffness. And he also complains of pain in the back or in the shoulders. And especially if you do the testing and if they are the HLA-B27 positive, that goes very much in favor of what we call ankylosing spondylitis. And later on, what happens, it leads to bamboo spine. So the vertebral process, they fuse with one another, and the spine, instead of the normal having lordotic curves, it becomes like a spine, and that leads to chronic backache for these kids as they grow. So enthesitis is related to seronegative arthropathies, and they usually have got a history of pain in the other joints, especially the back. Then we've got the tarsal tunnel syndrome, so where the tibial nerves enters the medial side of the calcaneal bone and goes through the tarsal groove. Sometimes inflammation of the surrounding structure, or if there is arthritis of the ankle, that can lead to swelling around this end, because this is a very narrow area. If the nerve is entrapped here, it was cause pain in the distribution of the tibial nerve from this point onward, and heel is a part of that. So there would be a pain in the mid foot part of the sole, as well as a lot of pain, non-specific pain in the heel area, and that is because of what we call as tarsal tunnel syndrome. Last but not the least, bursitis, people who are wearing ill-fitted shoes. So there is a lot of friction at the back, at the heel, where the Achilles tendon is attaching to its insertion point. So between the calcaneal bone and the insertion of the Achilles tendon, there is a bursa. So repeated inflammation or repeated friction can cause accumulation of inflammatory fluid within this bursa, giving pain at the back of the heel. So back of the heel pain, as I told you, could be because of Achilles tendonitis, which is a traction epiphysitis, or it could be simply because of a bursitis. And again, the history might be obvious in such cases, as these kids or these adults have got a history of wearing ill-fitted shoes. So their shoes are quite tight, and obviously because that leads to a lot of friction and leads ultimately to inflammation and then pain. So having discussed the causes of the heel pain, now let's move on and talk about how do we clinically approach a case of heel pain. Obviously, if a child or an adult comes and talks about that he's got a history of heel pain, it's important to take a meticulous history to see for how long the child or that adult is having problem of heel pain. So you ask whether it's something which is just acute, like started in the last couple of days, or it is something which has been ongoing. Then you also ask whether it's unilateral or bilateral, because obviously unilateral can be trauma or a few things like warts, etc., while bilateral can have many reasons, as we discussed earlier. You also ask about history of pain in the other joints, because arthritis related issues can cause heel pain as well. So you ask about if there are other joints involved, if there is backache. You also ask if there is association of this pain with the activity. So you ask whether if they walk or run, what happens to the pain? Does it get better? Does it get worse? But does it stay the same? What is the effect of having rest on their heel pain? And most important, a question which should be asked to every child, every adolescent, or every adult who presents with the heel pain is that when they wake up in the morning, what is the condition? So if they say that when they wake up early in the morning and they've got a lot of stiffness in the heel and it is very painful to take a few steps, and then over a period of time it becomes better, then it is a sort of a thing which is can be associated with plantar fasciitis. It can be associated with the severe disease, can be associated with so many other things as well. But if they say, well, it is better in the morning and then becomes gradually worse over the period of day, then it has got other causes as well. So it's very important to ask this specific question, that what is the pain when they wake up early in the morning, and what happens when they take a few steps as soon as they get out of the bed. This is very, very important. You also ask about their occupation, especially in kids. You ask about what sports they are doing, so you get an idea what sort of trauma their heels might be suffering. Then once you have taken the appropriate history, past history and everything, as you would take in any medical case, then the next step is to examine the heels. So obviously you ask the child or the adult to take off the shoes, take off the socks, properly lie on a couch with both heels in front of you, and then you look. So the first thing is inspection. So you look and compare both heels. So you see whether the color is fine, whether they are symmetrical, whether there's any swelling, bruising, things like that. You have to take a note of that. Then the next step, once you have inspected, then you would palpate. So you would use your hands to feel for any warts. You would also look to see which are the tender spots. So is there a generalized tenderness or there is a spot tenderness? Like for example, in cases of plantar fasciitis, it's usually what we call as focal tenderness exactly over the medial calcaneal tuberosity where the plantar fascia originates from. So if you press at that point, that usually leads to excruciating pain. You also do the lateral squeeze test. So you just squeeze the heel with your hands from both sides, for the medial and the lateral side. So you squeeze and you see if it produces any pain. And usually plantar fasciitis would produce a lot of pain. Similarly, severe disease would also produce pain when you try to squeeze the heel. You also do the calf squeeze test. So you squeeze the calf muscle and see if it leads to any pain, because when you're squeezing the calf muscle, it will produce more traction on the Achilles tendon. So if there is bursitis of the bursa beneath the Achilles tendon, or if there is Achilles tendonitis, then that would lead to pain at the back of the heel. And then you also look at the gait analysis. So gait analysis will give you an idea if the child is flat-footed, if he has got Bascavas or high arch. You also look at the footwear to see whether it is ill-fitting, whether it's got like uneven wear, because that would simply mean that they've got problem with their arches. You also see, especially in case of girls, if what sort of shoes they've been wearing. So again, those who wear flat shoes and they have got a lot of work which they have to do in a standing position, or they have to do a lot of walking in flat shoes, that can also produce a lot of strain on the plantar fascias, conflict to plantar fasciitis. And similarly, those who are wearing high heels over a period of time, high heels wearing would lead to tightening of the calf muscles, and the tightening of the calf muscle produces a sort of a pull which causes tightening in the plantar fascia, and then it hurts, causing plantar fasciitis. So you would do a CAT analysis. X-rays are rarely needed. X-rays would only be needed if somebody had an acute trauma and you think that there might be a subtle, overt or a covert fracture. So only trauma is an indication for X-rays. Other than that, if you do X-rays, you're not going to find anything, and it has got very low sensitivity and specificity. In other words, the diagnostic yield of X-rays in heel pain is very, very low. The only one indication is if there is a significant trauma to the heel, then you can do that. If you are suspecting stress fractures, obviously X-rays have got low yield in stress fractures. Bone scans are more better to detect stress fractures as compared to X-rays. So the bottom note is that X-rays are rarely needed. It's mostly a clinical diagnosis. So how to approach now? What are the differentials, and how do you know that what is the cause of the heel pain? So again, if you look at this algorithmic chart, so it shows that we have to look at the location of the heel pain. So location of the heel pain can be the plantar side of the heel, that is the under of the heel, or it could be the posterior aspect where the Achilles tendon attaches. So the posterior part of the heel. So you have to see where the pain is. If the pain is on the underside of the heel, then you ask what type of pain it is. If it is a burning or tingling sort of pain, it's not the aching pain, it's more of a burning sensation, then you're probably thinking of a nerve entrapment, or sometimes there could be what we call as a benign tumor of the peripheral nerve, which we call as a neuroma, and that might cause the, even though they are quite rare. Now, most of the times it would be a sharp or achy pain. Then you asked about the timing, and I asked you that you have to ask what happens when they wake up in the morning and take a few steps. So that type of pain, which actually when they wake up in the morning and they take a few steps and there is a lot of pain, that is very much indicative of what we call as plantar fasciitis. But again, it's rare in kids, mostly it occurs in adults. If the pain actually increases with prolonged weight bearing, so in the morning it's not that bad, but over a period of time it increases in severity, then it could be because of two reasons. It might be a plantar wart, which is usually most of the time unilateral, but rarely could be bilateral as well. Or it could be the heel pad syndrome, which is caused by the heel pad atrophy, but again it's mostly of the it mostly is caused in the older age population, so it's not common in kids. Then if it occurs at rest and all the time, then you should be thinking of calcaneal stress fracture, especially if they have been marching, like they've got a history of being in the armed forces, or they have got they are involved too much in sports which involves a lot of running, jogging, walking, etc. So again, you can suspect a calcaneal stress fracture. Again, I told you X-rays what you will lead. If you're thinking of stress fracture, then bone scan is a better diagnostic modality as compared to the X-ray. If they have got pain at the back of the heel, again, and remember here we also mean that the pain is at the plantar side of the heel as well as the posterior side of the heel. So if that pain is radiating to the back as well, and especially in children and adolescents, as I told you, the most common cause is severe disease, which is actually calcaneal apophysitis. So it's basically the inflammation of the growth plate, and not frank inflammation. It's basically because the growth plate in the calcaneus is growing very fast as compared to the rest of the bone, so can put pressure effects and cause pain. So that is what we call a severe disease. So in children, remember the most common cause is severe disease. Now coming back to the example that I told you in the beginning of this lecture, 13-year-old girl who had a history of 2 to 3 weeks of heel pain, no history of trauma, she's not into sports, she's otherwise well, no history of arthritis, everything is fine. So what do you think is the most probable diagnosis? The most probable diagnosis in that particular case is calcaneal apophysitis or severe disease, because she's an adolescent. She is in that age where the growth plates would be growing fastly as compared to the rest of the bone. Obviously, she hasn't got any trauma, so you're not suspecting any stress fractures. Plantar fasciitis could be one possibility, but it is quite rare. The history is not pointing in that direction, that she's standing for a long period of time, or she's running a lot, or it doesn't mention that she's got, like, pain which is is a lot when she takes a few steps after waking up. Then in adults, if it is around the Achilles tendon, then you would be thinking of Achilles tendinopathy, or sometimes what we call as Haglund's deformity. This occurs with the bursitis again. It can happen in children as well if they've got like ill-fitting shoes, but again, it's mostly common in the adult population. As far as treatment is concerned, moving on to treatment. Now, treatment of heel pain is treatment of underlying cause. Most of the times, painkillers have got very low effectiveness in heel pain, because most of the issues, like for example, if there is plantar fasciitis or Achilles tendonitis, the tendons are notorious, they've got a poor blood supply. So obviously, even if you are pumping them with a lot of painkillers, very little concentration reaches that area. So that's why painkillers usually are not effective. Usually, if you ask them, they would give you a history that they've been taking painkillers in not much amount, but again, it's not been that much effective. Then the question is, what is effective? Usually two things: physiotherapy and orthotic support are mostly successful. So research has shown us that physiotherapy, that means different type of exercises for your heels, and orthotic support is mostly effective. So what sort of physiotherapy? Usually those kids, adolescents or adults who have got plantar fasciitis, and when they wake up in the morning and when they take a few steps and it's very painful, we ask them that when you wake up, the first thing for the 4 or 5 minutes, they should be massaging their plantar fascia with the thumb. So they should be doing a sort of kneading massage into the plantar fascia for 4 or 5 minutes. So it's like stretches it and reduces the stiffness, and then when they walk after that, it's quite comfortable. It's not that painful, which it would be if they haven't had the sort of self massage, like massaging that area for 4 or 5 minutes. The other thing that they can do is usually, which is quite effective, is taking a small bottle, filling it up with water, and then you putting them in the freezer so that the water inside that freezes, becomes ice. And then we ask them that they are sitting on a chair and they put that bottle on the floor, and they put their foot on the floor and roll the bottle with their feet. So the feet is on top of the bottle, and let's say if this is the bottle and this is the feet, so they are rolling the ice cold water bottle with their feet. So it is, what happens is that it acts as like an ice massage. So it takes down the pain, it reduces the inflammation, and it is very helpful in reducing the pain. It's more effective as compared to the painkillers. Then there are other exercises which we call as stretching of the exercise, especially in females who have been wearing a heel for a lot. They've got like tight calf muscles. So stretching of the calf muscles by sitting and then putting a sort of a cloth around your foot, and then trying to pull it so that there is basically dorsiflexion of the foot around the ankle joint, causes stretching of the calf muscle. So the calf muscles are stretched, and that improves the shortening or tightness of the calf muscle. Then there are a few solutions in the form of orthotic support. So heel gel cushions can be placed, which actually give support to the heel and are very effective. They are placed in the shoes, and they give you the support and reduces the pain. The other things could be arches support, like those kids who have got flat foot, they can have arches which are available. You can buy it on eBay, they can buy it on Amazon, and they can be placed in their shoes, and that gives a bit of support to the arch, releases the pressure on the plantar fascia, and helps in pain control. For kids who have got severe disease, there is nothing much that can be done because it's a self-limiting condition. Over a period of time, it would wear off by itself. X-rays is of no use in severe disease because, again, most of the time the X-rays are absolutely normal, so it doesn't help. So history and clinical examination are your best tools in this particular case, and all they need is reassurance. So this was a short lecture talking about heel pain, what causes them, what is the algorithmic approach to a heel pain, and what is the treatment of heel pain, whether it is a child, whether it's an adolescent, or whether it's an adult. I hope you have enjoyed this lecture, and if you have enjoyed it, thumbs up would be extremely helpful. And if you haven't subscribed to my channel yet, please do subscribe, and also press the bell notification icon, so whenever I upload a new video, you're always on board with me. And if you want me to have special lectures for you, or if you like a topic on which I should be talking about, you can put it down in the comment section, and I will try to make a video on that particular topic. So have a very good day, and bye bye.